So if you have melasma and you follow me or read my book, you may be asking, what is maintenance treatment for melasma? Because it's something I talk about. Once your melasma is clear, you go on to maintenance treatment. So there's lots of different types of maintenance treatment. For my patients, it comes down to what they need to maintain their skin in the simplest, most inexpensive way. So it might just be tretinoin, it might be a little bit of hydroquinone on a couple times a week. It depends on where that patient kind of lands at the end of their treatment. But there are some studies looking into this. So a suggested maintenance regime in one study was 4% hydroquinone, 0.05% tretinoin, and a little bit of topical steroid applied twice weekly for 12 weeks. A randomized controlled trial with 242 people found that after melasma had resolved, that combination over 6 months on a tapering regime, so 3 times weekly for the first month, twice weekly for the second month, and once weekly for the fourth month, could prevent relapse in more than 50% of patients. In another study, there were 70 patients with melasma, and they were given the same triple combination cream with a 4% hydroquinone. In a 24-week study, the cream was found to be safe for moderate and to severe melasma for up to 24 weeks when used intermittently or continuously, with patients reporting no or mild adverse effects, including redness, scaling, burning, or little thread veins. Another study supported these findings in their 24-week study of 62 patients with melasma using the same triple combination cream with a hydroquinone 4%. They reported a very low risk of skin atrophy with this therapy and a marked reduction in epidermal melanin in those treated. So one maintenance treatment for melasma can be a couple times a week using 4% hydroquinone, tretinoin 0.05%, and a very weak steroid.